Morning students. Today our topic for discussion is immunomodulators. So what is the immune system and how it works? First thing, it will discriminate the self and non-self. For example, it will discriminate the antibody which is produced from the body and also differentiate the antigen. And second is destroys the infectious invaders and also regulates the self-immune responses. For example, it is dysregulated in cancers. And coming to immunity, you have two different types. One is innate or natural, adaptive or learned immunity. So innate immune response. The first line of defense against an antigenic insult is called innate immunity. Like defenses for physical defense like skin, biochemical defense like complement, lysosome and nephrones, cellular components like neutrophils, monocytes and macrophages. And coming to adaptive immunity, these are the humoral immunity and cell-mediated immunity. Humoral immunity, these are the antibody production which kills extracellular organisms, and cell-mediated immunity which has the cytotoxic and killer T cells and which kills the virus and also the tumor cells, and has the memory cells which remembers the antigen, and it in the future it kills whenever it invades the host. So who are all involved in the immune system? We know that innate immunity and adaptive immunity. Under innate immunity, the structures like complements, granulocytes, monocytes or macrophages, NK cells, mast cells, and basophils are all involved. For adaptive immunity, you have B and T lymphocytes, B antibodies, T helper cells, cytolytic cells, and suppressor cells. Abnormal immune response. So some of the abnormal immune responses are called as hypersensitivity reactions. There are up to 4 types of hypersensitivity reaction. They are: type 1 is anaphylactic shock, type 2 is mismatched blood transfusion, type 3 is due to serum sickness. It's called as serum sickness, which is seen in glomerulonephritis and arthritis. Type 4 is seen in TB and leishmaniasis. Autoimmunity, which is called it's a disease which arises when the body mounts an immune response against itself as a result of failure to distinguish self-tissues and cells from foreign antigens. So some of the diseases of autoimmune origin are rheumatoid arthritis, systemic lupus erythematosus, type 1 diabetes mellitus, multiple sclerosis, and so on. Immunodeficiency diseases can be divided into congenital and eccentric. In congenital, you have DGOR syndrome, SCID due to ADA deficiencies. Extrinsic, you have HIV causing AIDS. So coming to the proper topic, immunomodulators. These immunomodulators are defined as the drugs which either suppress the immune system or it will stimulate the immune system. So those who suppress the immune system, they are called as immunosuppressants, and the drugs which stimulate the immune system are called as immunostimulants. So immunosuppressants, under this you have drugs like glucocorticoids, that is prednisolone, and under calcineurin inhibitor you have cyclosporin and tacrolimus. Under anti-proliferative or anti-metabolite agent, you have sirolimus, everolimus, azathioprine, mycophenolate mofetil, and some other drugs like methotrexate, cyclophosphamide, thalidomide, chlorambucil, and also interferons. Some of the antibodies are anti-thymocyte globulin, anti-CD3 monoclonal antibodies, muromona, anti-interleukin-2 receptor antibody like daclizumab and basiliximab, anti-TNF alpha like infliximab and etanercept. These are some of the antibodies which acts as immunosuppressors. The therapeutic applications of immunosuppressors are autoimmune conditions like thyroiditis, where the autoantibodies to THS is 3 and the thyroglobulin. Myasthenia gravis, where the autoantibodies are directed towards ACH receptors. In type 1 diabetes, the immune responses which kills the beta cells. In glomerulonephritis, the immune complex deposition seen in the footpad of the glomerulus, and in rheumatoid arthritis. These are some of the conditions where you will be giving your immunosuppressive agents. And also in organ or tissue transplantation like kidney, heart, bone transplant, bone marrow transplant, and also in pancreatic islet transplantations. So Mainly, the immunosuppressants are given for organ transplantation and autoimmune diseases, as we already seen. The main problem of these immunosuppressants are they have to be used lifelong. Infection can occur. Sometimes cancer can also be one of the side effects, and they're highly nephrotoxic and also diabetic. So coming to individual drugs, so glucocorticoids, these induce the redistribution of lymphocytes, which decreases in the peripheral blood, which decreases in peripheral blood lymphocyte count. So second option is intracellular receptor. It is an intracellular receptor which regulates the gene transcription and down regulates the interferon 1 and interferon 6. It inhibits the T cell proliferation. Neutrophils monocytes displace poor chemotaxis. It has a broad anti-inflammatory effect on multiple components of cellular immunity. Some of the uses are used in transplant rejection. It is used in bone marrow transplantation. In autoimmune diseases like rheumatoid arthritis and SLE, hematological conditions, psoriasis, inflammatory bowel disease, and eye conditions. The toxicity of glucocorticoids are growth retardation if it is given for the growing child. Avascular necrosis of bone, it happens when it is given for longer duration. And which is the most common site of avascular necrosis is head of femur. Risk of infection, poor wound healing. This picture showing poor wound healing. Cataract. This is a picture showing cataract. Hyperglycemia, hypertension. So these are some of the side effects of glucocorticoids. So coming to cyclosporin, these are calcineurin inhibitors, which is a protein phosphatase activities that T cells of the immune system and can be blocked by these drugs. So calcineurin is a protein phosphatase which activates the T cells of the immune system and it can be blocked by drugs. So cyclosporin, these bind to the cytosolic protein called cyclophilin, which is an immunophilin of immunocompetent lymphocytes, especially the T lymphocytes. This complex of cyclosporin and cyclophilin inhibits the phosphatase calcineurin, which under the normal circumstances induces the transcription of interleukin-2. The drug also inhibits lymphokine production and interleukin release, leading to the reduced functions of effector T cells. The main action of cyclosporin is inhibition of interleukin-2 transcription. So uses of cyclosporin are mainly it is used for organ transplantation like kidney, liver, and heart transplant, and in autoimmune conditions like rheumatoid arthritis, IBD, and uveitis, psoriasis, aplastic anemia. Some of the skin conditions like atopic dermatitis, alopecia areata, pemphigus vulgaris, lichen planus, pyoderma gangrenosum. So toxicity of cyclosporin are renal dysfunction, trauma, hirsutism, hypertension, hyperlipidemia, gum hyperplasia, hyperuricemia, which worsens when it is given when the patient is having gout. Calcineurin inhibitors plus glucocorticoids, they are given together, they are highly diabetogenic. This is a picture of gum hypertrophy. The next drug is tacrolimus, which is also called as FK506 or Prograf. It binds to the immunophilin FKBP1A, followed by the binding of the complex to calcineurin and the inhibition of its phosphatase activity. In this way, it prevents the cells from transitioning from the G0 phase to G1 phase of the cell cycle. So tacrolimus is more potent than cyclosporin and has a less pronounced side effects. Uses mainly used for solid organ allograft rejection as a prophylaxis. And topical preparations available for the use of the atopic dermatitis and psoriasis. So these are the two drugs which comes under calcineurin inhibitors. And some of the toxicity of tacrolimus are they are highly nephrotoxic, neurotoxic, so it can cause tremor, headache, motor disturbances, and seizures. And it can cause GI complaints, hypertension, hyperglycemia, risk of tumors and infections on long use. Next is sirolimus. Sirolimus, it's also called as rapamycin. Trade name is rapamune. Contrary to cyclosporin and tacrolimus, the drugs that affects the first phase of T lymphocyte activation, sirolimus affects the second one, namely signal transduction and lymphocyte clonal proliferation. It binds to FKBP1A like tacrolimus. However, the complex does not inhibit calcineurin as it is done for tacrolimus. Here, it will go and inhibit mTOR protein, which is called mammalian target of rapamycin. It indirectly inhibits several T lymphocyte specific kinases and phosphatases, hence preventing their transition from G1 phase to S phase of the cell cycle. So sirolimus prevents B cell differentiation into plasma cells. So reducing the production of immunoglobulins like M, G, A antibodies. So this is a cell cycle. As we all know, cell cycle starts from G0 phase and ends with M phase. So this is the image of a cell cycle. So sirolimus, it is mainly used for the prophylaxis of organ transplant rejection with other drugs. Main toxicity are it increases the serum cholesterol, it increases triglycerides, anemia. Serum cholesterol mainly triglycerides, and anemia can be the one of the toxicity can occur in if the patient is getting sirolimus. Thrombocytopenia, hypokalemia, fever, GA effects, and risk of infections and tumors are some of the toxicities. Next is azathioprine. It's also called as immurin. The main immunosuppressive cytotoxic substance. It is a non-enzymatically cleaved to mercaptan purine that acts as a purine analog and an inhibitor of DNA synthesis. By preventing the clonal expansion of lymphocytes in the induction phase of the immune response, it affects both the cells and the humoral immunity. The uses are prevention of organ transplant rejection in the use in rheumatoid arthritis. Some of the toxicities are bone marrow suppression, lead to leukopenia and thrombocytopenia and anemia, increased susceptibility to infections, hepatotoxicity, alopecia, GI toxicity, and the drug interaction is with allopurinol. Mycophenolate mofetil, it's a prodrug of prodrug is mycophenolic acid. It inhibits IMPDH, that is inosine monophosphate dehydrogenase enzyme in guanine synthesis. It's a major target for both anti-tumor and anti-suppressive drug design. T cell, B cells are highly dependent on this pathway for cell proliferation, which has been inhibited by this drug. Selectively inhibit the lymphocyte proliferation function, antibody formation, cellular adhesions, and migration. Uses are prophylaxis of transplant rejections. Combination with the glucocorticoids and calcineurin inhibitors is effective. Some of the toxicities are GA toxicity and hemorrhagical toxicity. It can cause diarrhea and leukopenia, and risk of infection is more. Drug interactions, it decreased absorption when co-administered with antacids. Acyclovir, ganciclovir compete with mycophenolate for tubular secretion. So as we already discussed, some of the antibodies are being used for immunosuppressive agents. The antibodies, they are against lymphocyte cell surface antigen. They can be polyclonal or monoclonal. Antibodies are anti-thymocyte globulin, monoclonal antibodies like anti-CD3 monoclonal antibody, miromonab CD3, anti-interleukin receptor antibody like daclizumab and basiliximab, Campath-1H, it is alemtuzumab. Anti-TNF agents such as infliximab, etanercept, and adalimumab. LFA1 inhibitor like lymphocyte function associated inhibitor, that is ifalaximab. Coming to anti-thymocyte globulin, these are the purified gamma globulin from the serum of rabbits immunized with a human thymocyte. They are cytotoxic to lymphocytes and block lymphocytic function. Some of the uses of anti-thymocyte globulins are induction of immunosuppression in transplantation patient, treatment of acute transplant rejection. Toxicity are can cause hypersensitivity reaction and increases the risk of infection and malignancy. Anti-CD3 monoclonal antibodies, they are miromonab CD3. They binds to CD3, a component of T cell receptor complex involved in antigen recognition, cell signaling, and proliferation. Some of the uses of ImmunoModulators are treatment of acute organ transplant rejection and toxicity. It causes cytokine release syndrome, which presents with high fever, chills, headache, tremor, myalgia, arthralgia, and weakness. And prevention of this cytokine release syndrome can stop by giving steroids. Cytokine release syndrome is a common immediate complication occurring with the use of anti-T cell antibody inhibitors such as ATG and OKT3. The pathogenesis is that the antibodies bind to the T cell receptors, activating the T cells before they are destroyed. Cytokines released by the activation T cell produces a type of systemic inflammatory response similar to that found in severe infection characterized by hypotension, pyrexia, and dryness. Cytokine release syndrome is effectively a type of non-infective fever. That is about cytokine fever, cytokine release syndrome, which can be prevented by giving steroids before giving the drug. Anti-interleukin receptor antibodies like daclizumab and basiliximab, they bind to interleukin-2 receptor on surface of activated T cells, which blocks interleukin-2 mediated T cell activation. They are mainly used as a prophylaxis of acute organ rejection, and toxicities are anaphylaxis and opportunistic infections. Anti-TNF agents, these are tumor necrosis factor, which causes cytokine at the site of inflammation, which release cytokine at the site of inflammation. Some of the anti-TNF agents are infliximab, etanercept, and adalimumab. So normal inflammatory signal, whenever the inflammatory cytokines will go and occupy the cytokine receptor, inflammatory signals are given. This normal antibody will go and neutralize the cytokines and no signal is produced, so that no inflammatory signals are passed, no inflammation. So infliximab, these are mainly used for arthritis, Crohn's disease with fistula, psoriasis, psoriatic arthritis, and autoimmune spondylitis. Toxicity can lead to infusion reaction like fever, urticaria, hypotension, and dyspnea. Opportunistic infections like TB or respiratory tract infection, urinary tract infection is very common when infliximab is given for long duration. Next is etanercept. These are the fusion proteins produced through the expression of recombinant DNA. Ligand binding portion of human TNF alpha receptor fused to Fc fusion of human immunoglobulin G1. Uses are rheumatoid arthritis, mainly used in rheumatoid arthritis. This is adalimumab. This is a recombinant human anti-TNF monoclonal antibody. These are mainly used for moderate to severe active Crohn's disease. Next is LFA1 inhibitor, ifalazimab. Monoclonal antibody targeting the lymphocyte function associated antigen, which blocks the T cell adhesions, activation, and trafficking. Main uses are it is used for organ transplantation and for psoriasis. So, summary of the immunosuppressors. Mainly, the main drug is glucocorticoid. It inhibits the it has a lympholytic activity and anti property. It is used as a first-line immunosuppressive therapy in solid and hematopoietic stem cell transplant, and for ITP and rheumatoid arthritis, etc. And coming to sirolimus, it inhibits the protein kinase and inhibits the T cell response to interleukin-2 and blocks the cell cycle progression. Thalidomide, which inhibits the angiogenesis, reduces the phagocytosis, enhances self-induced immunity, increases the levels of interleukin-10, used in multiple myeloma, graft versus host disease, myelodysplastic syndrome, colon and prostate cancer. Mycophenolate mofetil, these are mycophenolic acids. It inhibits the ionosyl monophosphate dehydrogenase, which is a key enzyme in guanine nucleotide synthesis. This is mainly used for steroid refractory graft versus host disease, rheumatoid arthritis, and SLE. Leflunomide, it inhibits pyrimidine synthesis used in rheumatoid arthritis. And cyclophosphamide, it's an alkylating agent which destroys proliferating lymphoid cells, used in SLE, autoimmune hemolytic anemias, multiple sclerosis, vaginal granulomatosis. Neuromonar CD3, these are the T cell receptor complex, blocks the antigen recognition, is used in steroid resistance rejection. Tafilizumab and besiliximab, these are the interleukin receptor blocker, which is mediated by T cell activation. It is used in organ rejection in renal transplant patients in acute conditions. Azathioprine, also called as mercaptopurine, interferes with the purine nucleic acid metabolism and incorporates a false nucleotide, which is used in renal allograft, rheumatoid arthritis, SLE, LTP, Crohn's disease, and glomerulonephritis. Lastly, interferons. So these are interferon alpha, immune enhancing action, which is used in melanoma, interferon beta, which is used in multiple sclerosis, and interferon gamma, which is used in chronic granulomatous diseases. So now we are moving on to immunostimulants. So already we saw in definition that immunostimulants are, they stimulate the immune system. So immunostimulants are mainly used in immunodeficiency disorders, chronic infections, and in cancers. Specific immunostimulants are levamisole, thalidomide, BCG, recombinant cytokines like interferons and interleukin-2, other drugs like inocyclics, azimexone, imexone, thymosin, methyllinosine monophosphate, and immunizations like vaccines, immunoglobulin, Rho or D immunoglobulin. Coming to individual drugs, first is levamisole. It's an anti-helminthic. It restores the depressed immune function of B, T cells, monocytes, and macrophages. Uses for adjuvant therapy with 5-fluorouracil in colon cancer. It is used to treat immunodeficiency associated with Hodgkin's lymphoma. Toxicity is agranulocytosis. Thalidomide causes the birth defect, so it is contraindicated in women with a childbearing potential. It is enhances the T cell production of cytokines, interleukin into an interferon gamma. NK cell mediated hydroxyl against tumor cells or namely thalidomide. Uses, it is used in multiple myeloma. Bacillus calmette-guerin, which is a BCG vaccine. It is a live attenuated culture of BCG strain of Mycobacterium bovis. It causes activation of macrophages to make them more effective killer cells. Used as intravesical therapy for superficial bladder cancer. Adverse effects are hypersensitivity, shock, and chills. Interferons, these are antivirals. It has an antiviral activity, immunomodulatory activity, bind to cell surface receptors and initiate the intracellular events like enzyme induction, inhibition of cell proliferation, enhancement of immune activities, increased phagocytosis. So interferon alpha 2b. These are mainly used for Harris cell leukemia, malignant melanoma, Kaposis sarcoma, and hepatitis B. The adverse reactions with interferon alpha 2b are flu-like symptoms like fever, chills, and headache. Cardiovascular conditions like hypotension and arrhythmia can be can also occur with interferon alpha 2b, and CNS side effects like depression and confusion is one of the adverse effects. Interleukin-2, which is aldesleukin, these are the proliferation of cellular immunity, lymphocytosis, eosinophilia, release of multiple cytokines in TNF, interleukin-1 and TNF-gamma. It is used in metastatic renal cell carcinoma and melanoma. Toxicity, cardiovascular toxicity mainly, there is capillary leak syndrome, which leads to hypertension. Capillary leak syndrome, it's also called as Cluxon syndrome, a rare medical condition where the number and size of the pores in the capillaries are increased, which leads to the leakage of the fluid from the blood to the interstitial fluid, resulting in dangerously low blood pressure, edema, and multiple organ failure due to limited perfusion. Immunization, we have active immunization which stimulates antigen. Passive immunization, that is, we are giving free-formed antibodies to fight against the diseases. So active immunization, in that it activation of lymphocytes, proliferation of lymphocytes, and differentiation of lymphocytes happen. So whenever a macrophage engulf or phagocyte the bacteria, it activates the lymphocytes, which leads to proliferation of the lymphocytes, and it differentiates the B cells into plasma cells and antibodies. Differentiate the plasma cells to give antibodies. Under the active immunization, we have vaccines which are administered as a whole killed organism or a specific protein or peptide constituent of an organism. Booster dose is also given. Anti-cancer vaccines. These are vaccines. These are like vaccinating the patient with the autologous antigen presenting cells expressing tumor-associated antigens. Immunoglobulins. These indications of immunoglobulins are they're given for the individual who are deficient in antibodies, like in immunodeficiency patients will give immunoglobulins. Individuals exposed to an antigen, inadequate time for active immunization. For example, rabies and hepatitis B, in these conditions will be giving immunoglobulins. Non-specific immunoglobulins. These are antibody deficiencies are given in antibody deficiency disorders. Specific immunoglobulins. They are at high titers of desired antibody, which is given for hepatitis B, rabies, and tetanus. Rho or B immunoglobulin. These are antibodies against antigens on the surface of the RBCs to prevent the immunological condition known as rhesus disease or hemolytic disease of a newborn. So, it's also called as erythroblastosis fetalis when a Rh negative mother carries Rh positive baby. So, treating chronic idiopathic thrombocytopenic purpura in Rh positive patients who have not been screened up for this. Thank you. So we can discuss some of the questions. So let's solve some of the MCQs. So your first question is, the immunosuppressive agent that acts selectively by inhibiting helper T cells. The options are cyclophosphamide, azathioprine, cytosine arabinase, arabinoxide. So what will be the answer? So the answer is cyclosporin. The cyclosporin is a immunosuppressive agent that inhibits the helper T cell. So coming to the next question, the immunosuppressive action of cyclosporin appears to be due to. So in here they are asking about the action of cyclosporin. So the options are activation of NK cells, blockade of tissue response to inflammatory mediators, inhibition of gene transcriptions of interleukins, interference with antigen regulation. So the answer will be, so what is the action of immunosuppressive action? Yes, the option is C, the inhibition of gene transcriptions of interleukins. Okay. So moving on to the next question. All of the following are side effects of tacrolimus except, so tacrolimus is a calcineurin inhibitor. So what are the options? Diabetes, nephrotoxic, neurotoxic, and ototoxic. Here the question is except. So the answer will be yes, option D, ototoxic. So we have read that whenever the tacrolimus is given along with glucocorticoids, they can be diabetogenic. So diabetes is also one of the options. The next question is, Monitoring of renal function on regular basis is needed for. So for which drug you need a renal monitoring? For azathioprine or for mycophenolate mofetil or methotrexate or cyclosporin A? The answer is option B, cyclosporin A. Cyclosporin is a calcineurin inhibitor. So renal function should be monitored for cyclosporin A on regular basis. The next question is, name the mTOR inhibitor. Options are sirolimus, cyclosporin, azathioprine, and cyclophosphamide. Yes, the option is sirolimus. Next question is, besiliximab acts by antagonism against. Options are CD25, CD11A, TNF, including 2. So besiliximab is a monoclonal antibody which acts by antagonism in which action? Option is, answer is CD25. So option is A. The next question, which of the following is not a tumor necrosis factor blocking agents? The options are adalimumab, abciximab, etanercept, and infliximab. So which of the following is not a tumor necrosis factor blocking agent? Answer is yes, abciximab is the answer. So option B is the answer. The next question, which of the following statements about immunosuppressants are false? So options are sirolimus acts by inhibiting the action of interleukin 2, tacrolimus inhibits calcineurin pathway, mycophenolate acts by inhibiting GNP dehydrogenase, cyclosporin is an integral component of transferrin rejection regimen. So they are asking about which of the statements is false regarding immunosuppressant action. We all know sirolimus acts by interleukin 2, tacrolimus inhibits calcineurin pathway, and mycophenolate mofetil act by inhibiting inosine dehydrogenase phosphate, not GMP dehydrogenase. So that is the answer. The next question is, the drug that inhibits the de novo synthesis of purine. Cyclosporin, tacrolimus, mycophenolate, or infliximab. So they ask about de novo synthesis of purine. Option answer is option C, mycophenolate. So the drug which reduces the efficacy of cyclosporin is except phenytoin, phenobarbital, erythromycin, and rifampicin. Here the question is a drug which reduces the efficacy of cyclosporin. That is, efficacy is reduced when the drug is given along with enzyme inducers. So all the three are enzyme inducer except one. Answer is erythromycin, which is an enzyme inhibitor. So thank you, students.